Hey, Dr. Mulvaney. Here is my journal entry for the first week of PPAC. The only issue with this is I haven't been to Space Coast Discovery yet, but I'm going to try my best to just compare the two PPACs that I went to this week. But the first question that you asked in here was what were my initial expectations? To be honest, I did not have any initial expectations of PPAC. I had no idea what I was walking into. I've never even heard of a PPAC before. But from the nurses that came in and talked to us, I think they gave me a little bit of an idea, and it definitely matched that initial expectation of what they said. They were talking about how kids are going to be there with fetal alcohol syndrome, shaken baby syndrome, trisomy 21, big developmental delays. And so I saw all of those with some of the kids I was working with. And, I didn't like it. It was sad. So I guess from what the nurses had came in and told us about, I guess that did kind of meet my expectations, but I genuinely had no idea what I was walking into. Describe one moment that changed how you view pediatric chronic care or inclusion in a school setting. I didn't realize that, almost all of them have G tubes, and which was really good for me to learn how to access the site and flush it, and how to be gentle enough to where you're not going to pull it out of their stomach, and also just not putting a whole bunch of air in their stomach and making sure the line is flush, just like anything else that we would do. So that was interesting. I didn't realize how many of them would have to be fed that way. I don't think you really could include any those kids. I don't think you can include them in a school setting, at least the ones that are nonverbal. There's some that you could probably take to a school setting. One of them is Jacob at the Palm Bay location. I'll talk about him in a second because I actually did a evidence-based concept on him. Compare the environment. So, I can't compare Space Coast Discovery to the PPAC, but as far as the two PPACs that I went to, Melbourne and Palm Bay, they're pretty similar. The biggest difference with, Melbourne is it's kind of more of a house setting. It looks like a house, and it almost kind of feels like it. You just have different kids in different bedrooms, and depending on what their needs are, how agitated they can get. But then the PPAC over in Palm Bay, probably a little bit more structured than Melbourne, it seems like. I was only in the one classroom for each of them, but the way that they have them separated, and then also they have their own individual PT room. They have different room, quiet rooms for kids to go into if they are getting agitated, and but the play area outside, in Melbourne, I think was a little bit better. Consider the structure of the day, level of medical care. Yeah, so like I said, all of them have G tubes, and you're kind of teaching them how to eat, but that's where speech pathology comes in. They were kind of teaching them how to eat, not dart out the tongue, stuff like that. Education focus. You can educate the kids. There is education for the children going on. A lot of TV, a lot of Miss Rachel and things like Miss Rachel that teach them how to do different things, but there's really not much that they can do. And as far as the role of the nurses, they just kind of communicate with each other. What are the child's needs? Where are they going to work? The interdisciplinary teams, like the speech pathology, the behavioral therapists, kind of just working with the nurses, hey, what time can I work with this child today? What's their feeding schedule like? What's their level of attention today? What's their attitude like today? Because sometimes they might not be able to handle it that day. Some of them had, yeah, some of them were just they would get agitated pretty quickly. So the RBTs were really interesting, and I'll actually talk about that a little bit more below. How do the environments support the physical health? Like I said, I went to both PPECs. I'm going to the Space Coast Discovery on Tuesday, so I'll have to do more information. I'll be able to give more information next week on that for sure. But as far as development and learning goes, yeah, it really comes down. The nurses help. I think the nurse's role really is to just make sure that the child is healthy. They're taking the vital signs, they're making sure that there's nothing internally going on that needs to be addressed immediately. But then as far as like the development and learning goes, I think that really comes down to like speech and the behavioral therapists, because those are the ones that were really getting the children to do different things, like maybe even eat independently, or maybe like work with letters and shapes and try and get some mouth and tongue movement going, so where they can like communicate, even if it's just a word or two, just get them going a little bit more. So I think that came down to a lot of the interdisciplinary teams with that one. Which setting provided the most holistic care? I'll have to tell you that next week. I don't know. I don't know what to expect from Space Coast Discovery either. But I would say, if I was looking at holistic care, I think that the PPECs do provide a lot of holistic care. Yeah, they're passing meds. Yeah, they're giving feeds through G tubes. But I think it's a lot of comfort care. There was one kid. Oh my gosh, what was his name? He was really sweet. He was a good kid. But he had the shaken baby syndrome, and I guess they said that he was born completely fine, but I guess a few months old, he got shaken up pretty badly, and he got put into foster care for a little bit, and before his grandmother adopted him, and so now she takes care of him. But he's nonverbal. I can't say that because he says no to certain things, so I guess he's not nonverbal, but it's very, very limited, and so he really can't speak. He's also blind. He has a, oh my God, I should have looked that up. He has a drain that, is inserted in his cranium that helps drain some of the fluid going down into his head. I can look it up really quick. Let me see here. What is the drain? A shunt. He has a shunt in his head for hydrocephalus. So that was interesting. I didn't even know. I had no idea what that was either, and you can feel it. So that was interesting. Really sad. I don't think, like I said, I don't like that stuff. That hurts pretty bad. Didn't like it. But as far as holistic care goes, like I said, with him, where I was going with that was he would kind of get into spats where he would get like really upset, and you could kind of see his face starting to grimace and starting to just, you could tell his attitude was going somewhere, and you don't really know what he's thinking. But he's just kind of laying there in a crib. And so when you see that starting to go, you got to pick him up and you bounce him a little bit and you play with him and you like say nice words to him. And so I was playing rocket ship with him, and I was being gentle, but I would pick him up, and he was a thick kid. He's 5, and he was a thick boy. But I would pick him up and I would do rocket ship, and he thought that was like the funniest thing ever, because then when I would put him down, I would go boom, and he thought that was great. Like he laughed every time at that. So I did that with him multiple times. I got a crazy shoulder workout. It was pretty good. But yeah, so I would say as far as holistic care goes in the PPEC, I think that's a big part of it. I do. Describe the family involvement. Oh, yeah. So with the family involvement, I mean, the biggest thing with them is at the end of the day, they have like the nurse charts on everything all throughout the day. Was there any bumps or bruises at the beginning of the day, and then did anything change during the rest of the day? Is there any skin breakdown? Is there any like what's going on with the kid? Full head to toe physical assessment, and then also like what times they ate. Did they respond to the feeds well? Did they have any, did they vomit after a feed maybe? Maybe they got too much fluid or they just weren't feeling good. So all of that gets communicated with the parent at the end of the day. And I think that's really good. And then also the parents, there's some children who can eat solid food. There's some kids that can't eat solid food. So the parents bring in the food for whatever the kid needs for the day. And as far as like communication with the family, that it's really just giving them that report at the end of the day. Like, how did they do? Was there any issues? Is there anything that the parents should be aware of? And the parents also communicate with them at the beginning of the day if there's anything going on with them that maybe they were concerned about. So I think that's yeah, that's how they adapt to that, is just by giving a report pretty much every day to the parents, beginning and end. So identify one practice you observed. So this is going to be my evidence-based practice. So for the kid that I was talking about earlier, Jacob, he had fetal alcohol syndrome, or what was it? It was fetal alcohol spectrum disorder. That's what it was. And so for him, he was a sweet kid, but he had some behavioral issues. He could kind of fly off the handle a little bit, and he would start to pace, and you could tell he was mad when he wasn't getting something wasn't going his way. He wanted mac and cheese at one point. They did not have mac and cheese. That was a big problem, big no-no. Gotta have mac and cheese for Jacob. But the behavioral therapist, she was pretty much the only one that he would really listen to. He listened to everybody to a certain extent, but she had him in line. And I liked when I go back there, because he was at the Palm Bay location. So when I go back there, if she's there again, I'm gonna ask her about some of those techniques. Like, what kind of techniques does she employ specifically for her evidence-based practice? Like, how does she get him under control as well as she does? Because she taught him something called safe hands. And so this is what I looked up. So for the evidence-based practice, you got to give clear and consistent behavioral expectations, which is what she did. There's a line around the toys. He is not allowed to cross that line without permission. So he has to ask respectfully and politely, and if he doesn't get a toy. If he does, then he can, if the time is right, like if there's not anything else going on. Because sometimes maybe during a feed or something, he would be like, no, I want to play with dinosaur, and she would kind of nip that in the bud really quickly, and she would say safe hands, and then he would put his hands on his elbows like this, and yeah, he did really good with her. And they would even, the nurses and stuff, they would go, I can't remember her name, but they would go, do you want me to bring in Miss whoever? And then he would go, no, because he knew she was going to get him in line. So as far as like, so she was really stern with him, and sometimes she would express disappointment with him. And it says with the it's the American Academy of Pediatrics that I'm looking at, and it doesn't say anything about stern disappointment. You want calm, consistent correction, clear consequences, and positive reinforcement of desired behaviors, which I think that she did really good on the clear consequences and positive reinforcement of desired behaviors. That was like very obvious. She had that in control. And they said that his behavior has improved a lot over, like, I think it's a year and a half since he's been there. You know, and I think she was calm and she gave consistent correction. But I think she would have a look on her face, you know. And I don't personally see anything wrong with it. I think he did really good. I think that's what he responds to, and I think they probably just figured that out. But yeah, you could see like she would be very stern, express some disappointment, and that would kind of get him to just relax a little bit, do safe hands, and kind of get back on track. And then he would kind of cool out in about 2 or 3 minutes. So I think she did really good with that. I did like that a lot. So that's what the evidence-based literature says. Yeah, I think it aligned with the best practice. How does this practice improve outcomes? I mean, yeah, I guess the proof was there. They said that all the nurses, the CNAs, and the other RBTs there, they said that his behavior has improved. It's been consistently getting better. So I think that her method of doing things, I mean, she kind of comes on it like a stern mom, and I think that's what he needs. So I don't know what his family life is like. I probably should have asked about that. I'll ask about that next week and see who he lives with, and because I didn't get to see him leave. He went on the bus. That's what it was. He went on the bus. So I don't know what his family life is like, but I mean, with the fetal alcohol spectrum disorder, I mean, I guess we can kind of make a little bit of an inference without being too judgmental. But how did Space Coast Discovery support learning and inclusion? I don't know. I'll have to give you more information on that. Compare this to how development was supported in the PPEC setting. I mean, yeah, like I said, the development was supported through like things like Miss Rachel. They played Mickey Mouse Clubhouse, which I guess teaches you a little bit about shapes and stuff. I did a puzzle with Jacob at one point. He didn't want me to do the puzzle with him. I tried. I kind of sat there and watched him, but he did really good. He's almost like a savant. Oh, he also has a tablet where you can play piano, and he has like all the notes memorized of like the song that he wants to play. He could play a few different songs. He was playing Twinkle Twinkle Little Star a lot, but yeah, so they give them things to support development. And then also with some of the kids, there's one, Bryson, he's not bedbound. He can walk. He just was in the bed a lot. He kind of seems very tired. I think he was the trisomy 21, I think. Yeah. And he also had a G-tube. I flushed his G-tube and fed him. And he was really calm. He was a sweet kid. But he had an iPad where he was able to use pictures to communicate with us. And then he would choose which pictures he wanted. And then the voice would say something. And that's how we were able to figure it out. He kept wanting to play Connect 4, but we didn't have Connect 4. And they said that sometimes he just likes to make things up. I don't know if that's true or not. I think he really did want to play Connect 4 because he asked me multiple times, but I just had to keep telling him, I'm sorry, buddy. We don't have Connect 4. I'm really sorry. I was going to play Connect 4. I think that would have been actually pretty fun. So I think things like that, puzzles, games, things on the iPad, I think that's how they supported development and learning, different things like language and how to communicate properly and respectfully, and just, being calm. So why is it important, based on theory and evidence, to integrate developmental stimulation in both settings? Like I said, I don't know both settings. I don't know what to expect over there. But yeah, I'd say same thing. Just puzzles, games, constant communication, talking to them clearly and effectively without any extra jargon, just straightforward, to the point, and clear. I think that that is what is going to give them the best developmental stimulation, and showing them how to communicate, how we communicate, and hopefully them kind of mirroring us. I think that's going to be the best thing. What challenged me the most this week? What did I learn about my comfort level? I mean, what challenged me the most this week was the things like the shaken baby syndrome. I mean, it was the shaken baby syndrome. I felt absolutely horrible for that kid. Yeah, I don't like that. I don't even know what to say about it. I just didn't like it. Comfort level with them, totally fine. I don't have any problem playing with them or communicating with them. I feel like I know how to have fun with kids. I mean, I have a 5-year-old, so I know how to play with him. And honestly, and him with the shaken baby syndrome, yeah, he was in diapers. Yeah, he can't walk. He has AFOs, but he can't use them properly. Not yet. Hopefully one day, but he's also blind. And the fact that that could have been avoided, I think, is what challenged me the most this week. I don't like it. I don't like seeing it. I don't know. Maybe it's immature a little bit, or maybe selfish. I don't know. I don't do good with that stuff. I'm not good with that stuff. I don't like seeing it. It breaks my heart. He was a sweet kid. Yeah. It's not the setting for me, I can tell you that. Definitely something to work on. That was a problem that I had in maternity too when I went to the NICU, was seeing the sick babies, and one girl with neonatal abstinence syndrome, and her getting the morphine. I hate it. I literally hate it. It's the fact that you would do that to a child. It's gross, and that's something that I'll probably have to work on personally a lot. I wouldn't ever say anything to the parents or be unprofessional or disrespectful. It's just that it's heartbreaking. So I guess that's something that I need to work on. As far as growing in knowledge or confidence, I guess there's probably some things that I could do to learn how to communicate with the children better. I don't think there's a confidence issue. I think maybe I have a confidence issue with me being nervous in a new setting and something I've never done before. Even being in the hospital is nerve-wracking to me. So yeah, I could use a little bit more confidence. But as far as confidence with working with them, I didn't feel particularly unconfident. But I would say if I needed to grow anywhere, it would probably be managing my emotions better with working with kids that have those issues that weren't in control and kind of were given that by their parents. That I would need to work on. So, biggest takeaway and how it'll influence my approach next week. I'll definitely have a lot more knowledge going into next week, that's for sure. I think that'll be really helpful. I think dealing with kids' really, really big emotions, I think that will help. I think I was already pretty good at that because I have the 5-year-old, I've seen big emotions before, but their emotions are a little bit bigger and can kind of turn a little bit quicker. So I think that that will help influence my approach next week. Just being more understanding of what I'm walking into and what I need to do in my role. I think that will be the biggest help. And I think, like I said before, the biggest takeaway is probably just managing my emotions better when it comes to kids that have, fetal alcohol syndrome and shaken baby syndrome. I think that's my biggest takeaway. It was very sad, and it broke my heart. So that's what I'm going to work on. And I'm looking forward to going there again next week. It's not the job for me. It's not something that I plan on working in, but it is good to see different kinds of settings and having that background knowledge. Because if I ever do work with a kid in the hospital that's coming from a PPEC, then hopefully I'll be able to work with them a little bit better and have a better understanding of what they're going through and how to give them the best service that I can, like both emotionally, physically, intellectually, spiritually, all that. I think that's the biggest takeaway, is just seeing different environments. So anyways, I know this is really long, but hopefully I did it right. I'm going to put my reference in the bottom here, and yeah, if you want me to go a little bit more in depth, then just let me know. Thank you.